Welcome back. In your morning medical news, a House committee's final report says COVID-19 likely came from a lab in Wuhan, China. The 520-page report cites the virus's characteristics and illnesses among lab workers in late 2019. Republican investigators also criticized the World Health Organization's response and say the Biden administration overstated vaccine effectiveness. A Harvard research team finds exposure to fine particulate air pollution was associated with higher levels of inflammation among pregnant women, possibly leading to adverse birth outcomes. The study's authors say the data shows air pollution exposure in pregnant women should be minimized. It is a common illness that's more likely to spread in the fall and winter: pneumonia. It's an infection of the lungs and can range from mild to severe, depending on a person's risk factors. Mandy Gaither explains who's at the highest risk and what everyone can do to help prevent pneumonia from spreading as it gets colder.
Every year in the U.S., pneumonia causes more than 1 million hospitalizations and more than 50,000 deaths.
This is the time of year where respiratory viruses start picking up.
Pulmonary Dr. Joseph Cabaza with Cleveland Clinic says there are several types of infectious pneumonia, but bacteria and viruses are common causes of the lung infection. People at increased risk are adults 65 and older, and that risk continues increasing with age. And children younger than 5, the younger they are, the higher the risk. Chronic medical conditions can also put a person in danger, including heart disease, liver disease, lung disease, diabetes, and those with a weakened immune system.
The close spaces and minimal ventilation, that's kind of a perfect storm for anything that's spread via an aerosolized way.
That's why Cabaza says colder months, when people spend more time together indoors, makes it easier for all germs to spread. He says a key to protecting yourself and loved ones is vaccination.
The big three that can give us really bad viral pneumonias, let alone bad viral illnesses, are influenza, COVID, and RSV. And there is one vaccine for the most common and deadliest kind of bacterial pneumonia, which is called streptococcal pneumonia.
Cabaza says good hygiene practices can help slow the spread as well, including hand washing, not touching your face, and covering your mouth and nose when you cough or sneeze.
The CDC says common symptoms of pneumonia include chest pain when breathing or coughing, confusion, cough, fatigue, and fever or chills.